Hey y'all, my name's Caleb and I work as a critical care paramedic with WakeMed Mobile. Today we're going to talk about the Salad Mannequin. So this was devised by me and our medical director, Dr. Barry, to provide some education for us regarding suctioning and decontaminating airways. It's actually what SALAD stands for. So it's suction assisted laryngoscopy and decontamination. So this was coined by Dr. Jim Ducanto, and it is a technique used to decontaminate while you intubate, which is a big problem in hospital cardiac arrest, out of hospital cardiac arrest, or just intubation in general. How many times have you went to intubate somebody and the minute that the blade passes the cords or passes through the mouth, here comes everything out. Emesis, blood, secretions, everything. All right, so a little bit about how this thing works. So there is a reservoir for the fluid, which is the color blue right now due to an allergy in our department. But basically, this is simulating a esophageal varices bleed. So, of course, you'd be looking for massive amounts of blood just coming and coming and coming, and we have to take care of it. So it comes from the reservoir over to the box, and the box has a pump and a bunch of electronics in it that control the pump through this remote. So basically, the process of SALAD is very similar to regular intubation. You're just adding suction on top of it. So here we use a thing called the GlideScope Go, which I don't know if y'all have ever seen before. Basically, it is a video laryngoscope that allows us to get a view of the cords. It works especially well in cases like this because, of course, the secretions are covering the cords to where we can't see them. So as we suction, we also get a video view and we're able to pass the tube through the cords. So basically, the way this works, so we'll turn our suction unit on. And if you come and look in the airway right now, so there is fluid all the way in here. You can't see the cords. All right, so I've got the GlideScope Go on here. If I go and I try to get a view of the cords, as you can see on the screen, all I see is blue. That's not okay. A lot of people say intubate the bubbles, but that has a very low success rate. So what we'll do is we'll come in here, normal hand for your blade, your laryngoscope. You'll take your suction in your right hand. You'll come in, and as you're going in, you'll start suctioning. Now, what this mannequin will do is, as you're suctioning, it will add more secretions to the mannequin, which causes a big problem. So once you have the secretions clear, you start to get a view of the cords right here. All right, so once you have the view of the cords like you have here, you'll take the suction and put it in the left-hand side down here and kind of bury it. And what that'll do is, as secretions are coming back up via the remote, you'll be able to take your other hand and actually do the intubation. So we'll go down. As it's suctioning out those secretions, we'll pass the tube through the cords. We'll remove the stylet. We'll inflate our balloon. Pull the stylet out. Pull the blade out, and your patient is intubated.